Good morning, ladies and gentlemen. Dr. Gino Collura here with CEO Effectiveness, and incredibly humbled and privileged to be joined by Dr. Lee Fleisher. And I promise it's the first and last time I'm going to call him Dr. Lee Fleisher today at his request to call him Lee. So, Lee, good morning, sir.
Good morning.
How are
It's
you?
a pleasure and privilege.
Thank
Doing
you so
great.
much. Yeah, we've been looking forward to this time with you, to be able to learn from you, to be able to understand the importance of your research. But before we take a deep dive, right, into everything that you have accomplished and your insights on things that are happening in the world right now, I'd like to give folks a little bit more insight as to your background. So if it's okay with you, I'm going to go ahead and share some brief segments of your bio.
Sure.
Okay, so for folks who are attending, I know we have some folks still rolling in, but all of you know we like to be very punctual here at CEOE. So Lee is a chair of anesthesiology and critical care, as well as professor of medicine at the University of Pennsylvania Perelman School of Medicine, to which he received the Lindback Award for Distinguished Teaching in 2016. And that is no easy feat, ladies and gentlemen. That's a really big deal. His research focuses on perioperative cardiovascular risk assessment and reduction, measurement of quality of care, decision-making, implementation of cultural change, and health policy. He has received numerous federal, industry, and foundation grants and has published, get ready for this, over 163 original articles, 200 editorials, reviews, book chapters, and 9 books. So that's just to give you guys a taste of the caliber of individual that Lee is. So we are incredibly grateful to have him here with us this morning. So Lee, let me ask you, how are you doing? With everything that's going on, obviously we live in some perilous times, right? So how are you holding up, with kind of the climate?
It was exhausting. I still remember coming back on March 16th from a meeting of my colleagues. There were about 16 chairs of anesthesia, but 2 on the phone. The 2 were from New York. And they weren't allowed to leave because COVID had just hit New York.
Yeah.
So it was the chair at Columbia and the chair at Cornell.
Wow.
And I came back and said, we've got to prepare.
Mm-hmm.
So that next Monday, I usually get up around 4:30. I got up at 4. I was in the hospital by 5:50, 5:30. Wow. And I started to form a team. And I had been here every day, and getting calls on the weekend. So I did go back to my home on the weekend, but here every day in the morning. And it's been exhausting, but it's been satisfying to lead my team, satisfying that we shared a lot of our protocols with the rest of the world, mm-hmm. and satisfying that we can protect the public. And
certainly.
Philadelphia, we did pretty well. So yeah. I'm really proud of them.
That's incredible.
That's what's exciting.
So it definitely sounds like, you saw things that were coming, you rose to the occasion, and actually were able to implement some things to get ahead of the curve.
And we'll talk about, it was really interesting working with my executive coach and her mm-hmm. team in helping my team get mm-hmm. through this. And we can talk more about that.
Yeah, certainly looking forward to that. So to be mindful of time, everyone, just to let you all know, as we dive into the content for this morning, we're going to dive into 4 to 5 questions that are meaty. We're going to really piece them apart and give you guys some incredible insight. If you have questions that you want to ask Lee, ask myself, we have disabled video and audio on your side, obviously just to be mindful of time because we could talk for hours, right? So leave your question in the chat box, or if you take a look at the chat, I've put my email address in there already. So feel free to email me directly and we'll make sure that we get to your question and get you the appropriate response. So
even if it's after the program, which I'd be happy to answer questions after the program.
Outstanding. Fantastic. Thank you so much, Lee. So let's dive in. So let's kick off with our first question this morning, and I'm really excited about this one. So, there's 4 components of structure, process, intermediate, and ultimate outcomes. How do you see the effects of COVID-19 altering the way in which leaders in the healthcare industry address patient management over the next 6 months?
So, in structure, the first thing we did was, as we're reopening, so to speak, and taking in non-emergent and non-urgent care. Structure is everyone wearing a mask? Who are you letting into your hospital? Are we doing things that are appropriate given the risks? A lot of patients are not coming back to the hospital because of their fear of contracting it here. So we have to do everything possible to make them feel comfortable. The other structural thing, and that's a really interesting one. I've been talking a lot with CMS. I do a lot of work with the Center for Medicare and Medicaid Services, is how do you think about the geography? In other words, the city of Philadelphia, as we reopen, should there be a certain amount of ICU capacity, which is the reason we shut down elective surgery and why we shut down a lot of things? That's a structure question. What are those ICUs? Processes of care, how do we give, and we'll talk more about this, enough PPE, personal protective equipment? How do we make sure that we take people's temperatures? What are the processes we're doing to keep people safe? So some of that's the structure of the ICU, some of that's the mask could be in processes. And then the big question, and there's been a lot of work on outcomes, is, and it's complicated, is are patients developing infections from coming in the hospital? Or, particularly in my area, do we let people who have particular infections, who have a COVID infection, come and have surgery? There's work out of Europe and China to say if you come to the hospital and you get elective surgery and you're infected, your risks of having complications go up dramatically. So getting back to that processes, we are doing testing. No patient can come for elective surgery until they're tested. Now, a negative test is not perfect, but no symptoms, no temperature, a negative test, pretty good that if they have an infection, it's really an early or low risk. So again, the structures of the ICUs, the processes of looking at the infections by testing, by masks, et cetera, and the outcomes. How are our patients doing? Are they getting out of the hospital? And we've seen a dramatic decrease in the mortality, anybody ending up in our hospital. The risk at this hospital, the hospital of the University of Pennsylvania, has really been very low because of some of the things that we've learned from our European colleagues, from our Italian colleagues, as things we've implemented.
Absolutely. You know, it's so interesting, Leah, because I can totally relate to the fear that folks are having going to the hospital. My mother endured an accident not too long ago, about 6 or 7 weeks ago, and we had to rush her to the ER. She did not want to go. And I mean, she had multiple fractures on her face, her arm, and she was scared death. I mean, she was really shooken up about the idea of having to go to the hospital. And that sentiment has been carried. So it's comforting to know the protocols, right, that institutions are starting to put in place, not just from a structure perspective, but also processes with keeping the ultimate outcomes in mind. That's.
It was interesting. We just created a video. It just was finished last week. And we filmed it before COVID. Nobody's wearing a mask on our side.
Yeah.
Or the patients. And we actually have a big banner in the beginning saying, this was filmed before COVID. We now take all your precautions.
Very good.
So those important issues.
Matters. It does. Absolutely. The idea of before and after, and what's been the change. People want to see what has changed to ensure that we are being protected. So that is very insightful. So let me ask you, Lee, just one quick addendum to that. The first question is, so that's within the next 6 months. How do you kind of see the long-term forecast? Do you see this as something that's going to be perpetual for many years to come, or do you think it'll kind of wane off, or what's that kind of look like to you?
You know, the fear is, you know, if we believe Fauci, we're going to be in this for a year and a half. Hopefully there'll be a vaccine, and that point will go away, quote unquote.
Right.
But the fear of a pandemic and what we had to do should continue. And one of the things that Mark McClellan, a former administrator of the FDA and CMS, and you may have seen him a lot on CNN and others, has said, we really need to, this idea of getting to population health rather than the current sort of widget of paying for individual approaches. We need to get there faster. And we need to actually say, are all the hospitals in a region working together in case there's another pandemic?
Mm-hmm.
So I'm hoping that persists.
Certainly.
And we never have to use it again.
Yes, it makes two of us. I think that there's been a lot of learning across the board, right, with how to deal, what's working, what's not. Were we prepared? Were we not prepared? Right? What that whole entire culmination looks like. And to your point, I certainly hope this is a one and done, and we don't have to experience it again. So, okay, fantastic. So let's move on to question number 2 for this morning. So you have a fantastic colleague, Dr. Sagal Barsaid. She gave a wonderful lecture, and it is accessible on YouTube, folks, so I encourage you to take a look at it, and I'm happy to send a link to her lecture to you. But it made mention of this concept called micro moments. In your opinion, how important are these moments in maintaining resiliency in times of high stress where sustainable productivity may become threatened? And listen, with everything that's going on between COVID, civil unrest, resiliency is a big deal right now, and being able to overcome these hurdles. So if you could speak to the micro moments and,
Sure.
and kind of, how that all plays out from a model perspective.
I was reviewing another department yesterday, and people brought up something really interesting. And they said, when the chair walks down the hall, they're so deep in thought that they don't lift their head up and say hi.
Wow.
Yeah, I think they said, well, we know that he's an introvert. We know how thoughtful he is. He's deep in thought, but that mattered to them. And, if I'm walking down to the restroom at the end of my hallway and I pass people, they care if I stop and say hello. I've been actually told by my executive assistant, you didn't say goodbye. She feels comfortable enough to say, you were deep in thought. You didn't even say goodbye. And
Right.
The other interesting thing is one of our administrative people, her husband's, she's African-American. Her husband's a policeman. People may have heard of Mayor Rizzo in Philadelphia. They may have heard that the statue is taken down. And he works in a precinct with a lot of people that Rizzo brought in. And just talking to her this morning and asking how her husband is doing, you could see the smile.
Absolutely.
That I would stop while she was at the kitchen sink. I'm going to share something, if I may.
Please.
So we will have coming out an article in what's called the New England Journal Catalyst with Dr. Barsaid and I. And in the middle of the pandemic, she wrote a piece about emotional contagion.
Wow.
I think this is really important for leaders to know, that anxiety could just blossom and increase the contagion throughout the department if it takes hold. And when we first got into the COVID crisis, people didn't have enough PPE. We didn't have N95s. And the anxiety of donning and doffing all this equipment and really became important. Her article, that's why I reached out to her and said, thank you for sending this. And she reached out back and said, what can I do? So we did a survey, and this is from the numbers are less important. The size is important, but we asked 270 members of my department. So nurse anesthetists, residents, and the faculty. How anxious are you? Mm-hmm. And this is a relational factors, but here's what's interesting. If you at baseline are anxious, that clearly is going to, at the time that we're talking about, that's going to make you more anxious.
Certainly.
The fact that you're a CRNA, we can talk about that a little bit more anxious. But here's one of the key things. Just saying, I care about you, made them feel less anxious. And that appreciation from the supervisor came out incredibly strong as a mitigator. Now, what's the other side of this is this culture of anxiety, and that's really the emotional contagion. That's what's happening in the department. Do they have enough protective equipment? And do they feel safe to speak up? And where this came out really clearly, and we talked about it, is as I watched the members of this executive committee that I led as the charge to get us through this, that included intensivists, anesthesiologists, and realized we're one of the larger critical care group, and we took care of as many as any other critical care group of COVID patients. Mm-hmm. That as I watched my next level of leaders get anxious, I called up and said, we had an executive coaching team who said, we're going to help you. Mm-hmm. We're there. And they are PhD psychologists. It's talked about in the article, mm-hmm. Which will be out hopefully in the next 2 weeks. But they helped decrease the anxiety that I could feel because they were being hijacked by their emotions.
Certainly.
So getting back to that micro moments. Yeah. And if we let that anxiety stay here a lot, that actually increased burnout, decreased resiliency. So it was we thought burnout affected anxiety. It's the opposite. The more anxious the team, the higher the burnout. So it became, the other thing is I am sort of a high energy leader, and I bounce around a bit and talk to lots of people. And what I did naturally, and we've actually debriefed by the executive coaching team, is I decreased my level of energy. Mm-hmm. I was here at 5 a.m, way before anybody else, 5:30. And when they came in, they saw someone totally calm. So I used a different style.
Absolutely.
Because I wanted to have them mimic me. So I think, it gets to, and Segal was helping us, this idea of appreciation and making sure that there's no emotional hijacking, that contagious doesn't take hold, was so important. And we've been called out by the entire health system for being a week or two ahead.
Love it.
Of many other departments.
Love it. It's incredible. One of the things that we always tell folks that we work with is, from a leadership perspective, your conversation with your team should be at the level of dialogue, right? The idea of if you are feeling like you have to walk on eggshells, if you are feeling like you are restricted or confined, you cannot speak your truth, speak what's on your mind, that will lead to pent-up anxiety, right? And so being able to decrease that and invite a conversation that, listen, no judgments, let's just have a productive discussion, right? And what goes into that? It's amazing in how many different domains that simply doesn't exist.
But the interesting thing, and people have debriefed about this, is I believe in that diversity, and I would go around and talk to individuals and get what they needed. But when I ran my 45 to 1 hour call every morning at 8 a.m. Or 7 a.m., one of the two, I did not do my standard style. I actually felt in this moment, they needed total control from the top. And I would actually call on each person because it was all done by Zoom.
Certainly.
So it's interesting how they know me as somebody they can speak safely to, and the rest of the day they would come in and talk.
Of course.
But in the leadership moment of what we needed to do, they needed a command and control leader to set the day's agenda out.
Absolutely.
So
it's a really important thing that you just said, because there has to be who's the beacon, right? At the end of the day, who is setting the platform, but at the same time, it doesn't negate team members' ability to share their thoughts and share their ideas and have conversations, but there needs to be an understanding of, this is the direction that we're headed. This is the blueprint, this is the roadmap. But I think being able to balance between the two, that's a skill set. I don't think that's necessarily something that folks kind of just have. I think it's acquired over time, and it takes a little bit of objectivity as well to be able to understand at what time do I put which hat on and when does it make the most sense.
I'm very fortunate. You know my cousins, Larry and Ronnie Fleisher. So I get to talk to them. I have had an executive coach for 10 to 12 years. I'm a very different leader today at 16 years in my role than, and that capital of 16 years of doing it one way, it was okay to set agendas in that moment because we didn't have time. So it's really interesting.
It is, but you know, it's amazing. Just quick caveat. I have had some incredible discussions with Ronnie, and he's just an incredible guy. Really, really, truly is salt of the earth. So, all right, moving on. In the interest of time, because I know we've got about 9 minutes left. So, you have a recent article. The recent article is Fostering Belonging in Academic Anesthesiology, Faculty and Department Chair Perspectives on Supporting Women Anesthesiologists. So within that article, there's a distinct call to understand the responsibility of an employee as compared to the responsibility of the leadership team an employee is following. So kind of backsliding on what we were just talking about. So what are some of the things that leadership teams and employees can do to break barriers of communication and understanding that they do exist, right? So, you know, we're talking about the evolution of leadership and being able to figure out that balance. But let's say folks who are already stuck in their ways and they don't know how to break those barriers. What's some insight that you can give folks? Because listen, ladies and gentlemen, this is something that applies not just in your professional domain, it will apply to your life in general, right? And with the kind of adversity that we are dealing with right now, it's really important to understand how to break that. So Lee, please, sir.
Yeah, and I'll share the slide that Megan Lane Fall, one of my amazing faculty, actually created. And she used Maslow's hierarchy. And it was interesting when we started this. When I got here 16 years ago, there were 6 women in the department and 45 moderately old white men. So it was a very homogeneous department. And it's without a lot of women, how do you get to that 30% rate that you really need to tip? And that's what I keep hearing. So a lot of it is, you know, how can I be a mentor? But also being able to tell the truth to them, to being able to say, look, I can do a lot. And you know, this idea of love and belonging and psychological safety. Amy Edmondson is another collaborator, brilliant woman who's written about leading teams and has a newer book. And you know, I'm happy to provide sponsorship, which I do frequently given my roles. But, you know, they need to talk about what they need from us. I mean, this idea of the imposter syndrome is unbelievably strong. And one of the women, as I elevated her to a vice chair, the more I talked to her, the more it became clear that executive presence was something that she was scared to do. I still remember even myself when I got here, my first picture, you can't tell I'm the chair. If you look at any picture today of my department and I, it is very clear that I had that imposter syndrome.
Certainly.
So how do they speak up? How do they tell us, you know, what are their goals? This idea of determining career goals and objectives is really important. And a lot, I've learned to listen better between advice from my wife and my the women who are willing to come in here and say, you missed. You sort of got there. And this particularly with the George Floyd and everything and what we're going through with race today, you know, it's scary to have a lot of these conversations as the leader. And how do we open up? And I was listening last night to the report on CBS, and they said, you know, you don't want to just say, tell me how to talk to you, the white individual to the African American, but you want to have sort of a lot of these, you want to promote the safety and what they need, and they need to be able to help you get there by also telling their needs and being able to express what it is. One of the strongest issues I have in my own department and is I have a lot of women and some men who are trying to balance family and career.
Certainly.
And I can admit that career, very driven. And I can help them identify a career path, but I need to understand what that career path, what do they want?
Certainly.
I mean, and this goes for the men too. What are they willing to give up? Can they delay getting on the fast track? I just had a discussion with somebody. In order to take on a certain role, you have to be nationally known. You have to go to meetings once we're allowed to go to meetings again. Is that what you want?
Right.
And in the end, I'm not sure it's what he wants. And being able to articulate, knowing that there are certain requirements. Hopefully that answered the question, but we've thought a lot about that two-way dialogue.
Certainly. And it's amazing too, Lee, because so many folks, they think they know what they want, right? Until they get the thing that they want and they realize that it's not what they wanted in the first place, right? And so and sometimes it's exactly what it is that they wanted. So being able to help them figure out exactly what that means. I know in our experience, it's rare to find individuals who have a very crystal clear understanding of what that projection looks like. There's a little bit of dialogue that has to happen in conversations for them to understand, well, what's the expectation that you have for yourself? What's the expectation for what that tomorrow looks like?
One of my vice chairs, and we can go a few minutes.
Okay.
One of my vice chairs, this woman who's fabulous. There was an opportunity when she was young. It wasn't exactly where she wanted. And we had a discussion, and she still remembers me saying to her, this is a good test if this is what you want.
Absolutely.
And this is a safe test, because if it's not right and you fail, it's a safe place to fail. It won't affect your career, and I won't be upset.
Yes.
But I'm not going to put you into the big job.
Absolutely.
And she still remembers that, and it accelerated her interest.
And that's an invaluable, I mean, that's huge. What an invaluable thing. I mean, truly, when you think about the ability to kind of dip your toe in the water and say, okay, does this feel right? Is this where I want to go? This is how I want things to be. So that's fantastic. So, all right, moving on, just in the interest of time. So last final question. Listen, as a society, there's a lot going on, right? We all know that, we understand that stress, anxiety are paramount right now, walking on eggshells. But there's a very unique intersection, right, between biology and culture. So that crossroad that exists, how significant, in your opinion, is the statement culture gets under the skin? So meaning, how important is biology as well as cultural habits in optimizing human behavior as well as human interactions?
So about 3 years ago, I started getting confused and bye-bye birdie, what's the matter with kids today? And trying to understand why I was either getting old, or were there things changing, which was culture, or is it some biology that my age not understanding? So I hired a linguistic anthropologist into the department who co-directs my lab. And we've actually had him planted in some of the discussions and watched, and he's watched us talk past each other instead of with each other.
Absolutely.
We don't join. And it's really easy to say, what's the matter? This is their fault. They don't understand and they've made some choices. And some of this is biology of who we're hiring. And some of this is the culture of the times. And some of this is a culture we're creating. So I'm trying to use an anthropologist to actually studying the educational culture rather than hiring an educator.
Absolutely.
Because I actually think that content expertise is less important than saying the way we talk to each other may be more important than that culture of because the biology hasn't changed that much. I mean, these are our kids.
Absolutely.
But grew up in what we did as opposed to we growing up, you know, I'm a baby boomer. They're growing up children, the baby boomers. And so it's been an interesting exercise.
It's amazing because when you look at the intersections, and to your point, I applaud you on hiring an anthropologist. Of course, I'm biased being an anthropologist myself, but you made the right choice. You made the right choice. But to be able to dive into and understand not what's happening at that 500-foot view, but at the 30,000-foot view, right? And so when you have a content expert, you can dissect the 500-foot view. But when you really want to understand the dynamics of what's the structure, what's the blueprint that's being laid, it does require a bit of different insight. So I think as we see the continuum of what's happening right now in society, in culture, to the model that you showed earlier about stress and anxiety, I think that there are some very real consequences. And by the way, not to even mention, this is a whole different discussion, right? But the use of technology, right? What that has done from a conditioning perspective for real time and immediate reward, and kind of expecting the same thing in human interactions that we have. But we'll leave that topic for another
you
day.
know, that got to this last question, which we won't get to, but yeah. This diversity of ideas, you know, one of the things that I'm proud of is when I got tested, I was told, you know, one of those batteries that I'm an architect. And what the advantage of being in an academic institution is collecting people who think differently around me. And having an anthropologist and an organizational psychologist and a behavioral psychologist, and them just saying to me, you know, miss the point. We occasionally, the anthropologist and I go and have lunch with Daniel Kahneman. Oh, wow. Smartest man I've ever met, the Nobel laureate. And just listening to the way he thinks, and it just brings new ideas to me. Now, that adds to my ability to lead.
Absolutely.
Hearing somebody that smart question everything I'm doing, which is okay.
Absolutely. Yeah. But it rocks the boat a little bit, and it gets the juices flowing in a different way. So absolutely fantastic. Lee, I cannot thank you enough for your generosity and your time. I know we're a few minutes over, so we want to be respectful and mindful of your schedule as well as everyone who's attended. So thank you so much, folks. Again, if you want to ask questions, by all means, you can leave them in the chat box, send an email to me. I will make sure that Lee gets them and we get you an appropriate response here in short order. But Lee, have a fantastic day. Have a fantastic week. And we just can't thank you enough for your insight, your wisdom, and your time.
My pleasure. It's really a pleasure working with you. Thanks.
Outstanding. All right. We'll be in touch. Take care.
Bye.
All right. Bye-bye.